Hello everyone! I hope all are doing well. Here is a video regarding an Orthoviva model. Come on, let us all look into it.
Hi, I'm Ruby. Your good name please.
I'm Henry.
Genovia Marnagar bus.
Yes, it's 12B green color bus. I think within a minute the bus will arrive.
Thanks for your information. Where are you going, Henry?
I am waiting for 2D bus. Because today my Orthopaedics Viva exam.
Okay, all the best for your exam.
Thank you, I think this is my bus.
Fine, bye Henry.
Hey Scott, what a surprise you have Viva today.
Yes, buddy.
How is your preparation for the Viva?
Henry, I referred several books and internet for my Viva. But I'm so panic.
For what?
Whenever I am thinking about my Viva exam, I just feel scared.
Scott, you're prepared well for your exam, then why should you get worried about that? Relax and attend your Viva perfectly. Good luck, my friend.
Now I'm perfectly alright. Thank you for your advice. Orthopedic Viva will start within a minute. Students, all of you get ready for your Viva. I will call you one by one as per your roll number.
Excuse me, sir, may I come in?
Sure. Come in. What is your roll number?
82746.
Okay, let's start the Viva session. Are you ready?
Yes, sir.
What is Cole's fracture?
Fracture of the lower end of the radius 1 inch above the articular surface.
Okay, what is deformity of Cole's fracture?
Dinner fork deformity due to dorsal displacement of the lower or distal fragment.
Okay, tell me, what are complications of Cole's fracture?
Stiffness of the finger and shoulder, malunion, carpal tunnel compression, rupture of the extensor pollicis longus tendon, non-union.
Do you know Smith's fracture?
Yes, sir.
Okay, tell me something about it.
Fracture at the distal end of the radius, where the displacement of the distal fragment is the opposite of that in Cole's fracture.
What is Barton's fracture?
Fracture of the distal end of the radius involving the articular surface.
Can you explain the types of Barton's fracture?
There are two types of the fracture depending upon the displacement. Volar Barton's fracture, the fracture line is placed obliquely separating either a large volar fragment. Dorsal Barton's fracture, the fracture line is placed obliquely separating either a dorsal fragment.
Well said. What is mallet finger?
A mallet finger is a deformity of the finger. It occurs when the tendon that straightens the finger is damaged at the fingertip. It is also known as baseball finger.
Which splint used to correct the mallet finger?
So I think polyvinyl chloride PVC, and foam white mallet distal interphalangeal finger support brace splint joint protection injury.
Nice. How to apply mallet finger splint?
The splint applied with proximal interphalangeal joint in 60 degrees of flexion and the distal interphalangeal joint is hyperextension.
Good. What is Decker-Vein's disease?
This is an inflammation of the tendon sheath of the abductor pollicis longus and extensor pollicis brevis.
What are the clinical features of Decker-Vein's disease?
Pain in the point of styloid process of radius. Tendon sheath get thickened. Weakness of grip. Movement of thumb is painful.
Good. Tell me something about trigger finger.
Trigger finger is a condition in which one of your fingers gets stuck in a bent position.
What are the main clinical features of trigger finger?
Active flexion is possible but extension is not possible. Tenderness in affected finger and clicking sensation.
Okay, how can you release lock on the trigger finger?
Locking can be released by friction massage, stretching, ultrasound, paraffin wax.
Is trigger finger is permanent?
No, trigger finger can almost always be fully treated and the finger will likely return to normal, but it may make time.
Nice. Your Viva session completed. You may go now.
Thank you, sir.